Okay, today we're going to discuss about the diabetes. So, when we are checking diabetes, we have the blood test. There are two. We know there are three type of blood tests. Blood sugar tests. There are three. Random, random. We are calling it diabetes if it is more than 200. And this we have the fasting and the 2 hours postprandial. And the fasting sugar blood test, if it is more than 125, and blood sugar for the 2 hours postprandial if it is more than 200. So here, if it is random, uh, it's for general. We detect diabetes for general, but if we want to specifically know if the problem, if it is the diabetes, diabetes, the problem is divided into two category. The problem in basal blood sugar and the prandial blood sugar. Prandial is when we are taking foods, so there is a disturbance in the blood sugar regulation in the food taking when we are eating. And the basal, when we are sleeping and we are do activities, the our body started to regulates. That is called basal. Basal when we are sleeping. When we are sleeping, there is problem in blood sugar regulation. That is the most common problem in the diabetic patient. So that's why, as for the later patient, we're using the insulin for basal. But we are talking about the blood sugar test for defining if it is basal or prandial. So we are just using these two blood tests, fasting and 2 hours postprandial. This is the general range. Fasting is more than 125. To 4 hours postprandial is more than 200. Then we are moving to fasting glucose. Is the range is here, 90 to 120. This is specifically for measuring or differentiate the problem, to discover the problem if it is in basal or prandial. So fasting is 90 to 120, and 2 hours postprandial is less than 180. This the range. The range for the diabetic. If it is more than this already. This is the normal type, the fasting 90 to 120, and this is the 2 hours postprandial must be less than 180. So after eating, in 2 hours postprandial, after eating, you have to wait 2 hours, then take the blood sugar test again. So fasting is basal, and 2 hours postprandial is prandial. The problem is there. Just keep in mind and the range between them has to be 40 to 70, not more than 40 to 70. So, for example, uh, if we have the sugar level is 90, no, is 200, and the fasting is 200, and the 2 hours postprandial is 300. The difference between the fasting and postprandial is 100. So it means that the problems are in the two. the problems are in the basal and prandial. So the patient has a problem in the basal and prandial, the two of them. That's why it uh, it 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 reflects in the medication, because in diabetes, the medication, we are using the basal like metformin and sulfonylurea, and if it is prandial, we know we have gluco glucobay glucobay, that is acarbose, like that. That is very, the medication depends on how we how we judge if there is a disturbance in the basal or prandial. Hope we're knowing this. And also, in addition, if the patient has chronic kidney disease, it has to be less than 200 the sugar. So this is, if so repeat it again. If we are fasting glucose is 200, that is uh, the basal, right? And if it is the 2 hours postprandial is 300. 300. So the difference is 100. So 100 means it's the normality. The difference between these two tests is 40 to 70. If it is 100, it's more than. So it's very dangerous. So the patient, it means that the patient has two of the problems. If Because sometimes a patient has only one problem, which if it is which is basal, either basal or either postprandial. Okay, hope we are getting this. Bye bye.